Definition of health given by WHO includes which of the following dimensions: social, physical, mental, economic. Optimal health life includes moderate physical exercise, sufficient nutrition, mental peace. Which of the following is the current trend in healthcare? Community participation. Standard of living includes all except, so it does not include human rights, while it includes income, sanitation and nutrition, and level of provision of health. All of the following indicators are included in physical quality of life index PQLI except per capita income. So what is included is infant mortality rate, life expectancy at age 1 and literacy rate. PQLI included are literacy and infant mortality. Income is not included and life expectancy at birth is not included, but while life expectancy at age 1 is included. PQI includes IMR, infant mortality rate. Human living standards can be compared in different countries by PQLI, that is physical quality of life index. Human development index includes all except, so it does not include crude death rate, while it includes education, life expectancy at birth and GDP. Human Development Index HDI value ranges between 0 to 1. The value of HDI in India is 0.545. Human Development Index includes life expectancy at birth. Human Development Index is composite of the following except, so it is a composite of life expectancy at birth, adult literacy rate and mean year of schooling and CDP, while it does not include life expectancy at 1 year. Age limit for HDI is none, but if none is not an option, then 25 to 85 years. Poverty index does not include income, it includes long life, knowledge and standard of living. Concepts of disease causation. All of the following are components of epidemiological triad except, so epidemiological triad constitutes of environment, agent and host. It does not include manpower. The manner in which a disease behaves in a community is determined by infectiousness of disease, density of aggregation of population, standard of hygiene and size of reservoir of infection. Web causation of disease is most appropriate, better for all the related factors associated with causation of disease. Epidemiological web of causation theme was given by McMahon and Pugh. Demarcation line in iceberg disease is between apparent and inapparent cases. According to the concept of iceberg phenomenon of disease, all of the following statements about the submerged portion of the iceberg are true except, so what is true is it includes subclinical cases, it includes carriers, it constitutes undiagnosed reservoir of infection. What is not true is that diagnosis can be made with available techniques. All show iceberg phenomenon except chickenpox does not show iceberg phenomenon. Influenza, polio and hepatitis show iceberg phenomenon. The term disease control describes ongoing operations aimed at reducing the following except the virulence of the disease agent. So the term disease control describes ongoing operations aimed at reducing the incidence of disease, reducing the financial burden to the community and reducing the disease duration. A state of disease endemicity in which disease transmission has been stopped but the agent persists is elimination. The only disease which has been eradicated is smallpox. Disease eradicated from India is smallpox and guinea worm disease. Disease which is close to be eradicated in India is diphtheria, measles and polio. In a population to prevent coronary artery disease, changing harmful lifestyles by education is referred to as primary prevention. A concept directed against prevention of risk factors of coronary artery diseases is primordial prevention. All the following are methods of health promotion except immunization. So methods of health promotion are nutritional changes, behavioral changes and health education. Immunization is primary prevention. Vitamin A prophylaxis is an example of specific protection. Iodized salt and iodine deficiency control program is primary prevention. Pap smear is an example of secondary level of prevention. Primary prevention in coronary heart diseases is exercise in high risk area, BP monitoring, salt restriction, and statins. Primordial prevention in myocardial infarction are maintenance of normal body weight, change in lifestyle, and change in nutritional habit. Screening for hypertension is not a primordial prevention. An example of disability limitation is resting the affected limb in neutral position. Disability limitation is a part of prevention or tertiary prevention. Any loss or abnormality of psychological, physiological, or anatomical structures or function is impairment. Which is the correct order? Disease, impairment, disability, and handicap. The restoration of body function is known as medical rehabilitation. Loss of part or function is known as impairment. Which of the following is primordial prevention for NCD, that is non-communicable diseases? Preservation of traditional diet in low NCD area, exercise in high NCD area. Primordial prevention is done in population without risk factors. Primary prevention does not include early diagnosis and treatment. It includes health promotion, specific protection, and health education. Primary prevention is marriage counseling and immunization. Primary prevention includes marriage counseling, health education, and health promotion. Sputum examination for acid-fast bacilli is a type of secondary prevention. Iron and folic acid supplementation to the children forms specific protection and primary prevention. Iron and folic acid supplementation forms specific protection. Analysis of routine measurement is aimed at detecting changes in environment. Monitoring. About monitoring, true is analysis of measurements for detecting changes in health status, an essential part of surveillance and smaller concept. Missing cases are detected by sentinel surveillance. The most important function of sentinel surveillance is to find the total amount of disease in a population. Disease under WHO surveillance is rabies. International disease surveillance is for polio. Which disease comes under international surveillance? Salmonellosis. True morbidity in a population can be calculated by active surveillance. Sentinel surveillance is done to know the hidden cases in community. HIV prevalence can be assessed by sentinel surveillance. All are morbidity indicators except, so morbidity indicators are period of stay in hospital, attendance at OPD, notification rates. Not an indicator. Doctor and population ratio is not an indicator of morbidity. Which of one of the following is not a utilization rate? Population and bed ratio is not a utilization rate. Bed occupancy rate, bed turnover ratio, and average length of stay is a utilization rate. Sullivan's index indicates life free of disability. Burden of disease is best detected by disability adjusted life year. DALY true is 1 DALY means 1 lost year of life. DALY measures years lost due to premature death and years lived with disability. James Lind is known for prevention of scurvy by fruits. Father of surgery is Ambroise Paré. Father of public health is cholera. Edward Jenner died in 1823. Socialization of medicine leads to all except. Socialization of medicine leads to free medical care supported by state, eliminates the competition among physicians in search of clients, ensures social equity, universal coverage of health services, but it does not lead to ensure complete utilization of services by all people. If alternate of medicine were accepted as a modality of therapy, then yoga would be best described as a form of preventive medicine. Which of the following is the contribution of Germany to public health? Instituting compulsory sickness insurance. ICD-10 is arranged in 3 volumes. ICD-10 code in 21 includes all except, so it includes lack of exercise, alcoholism, unhealthy found. It does not include poisoning. ICD chapter 21 includes all except, So it includes alcohol, tobacco, and drugs, but it does not include injury. Poisoning and injury is not included. One of the following is not true of International Classification of Diseases. So it was revised by UNICEF is not true. It is revised once in 10 years. That is true. The 10th revision consists of 21 major chapters. It is accepted for national and international use. It provides the basis for use in other health fields. Which events occurred before 1900 AD? So epidemiological work on cholera by John Snow, work on scurvy by James Lind, and Chadwick work on cholera in London was done before 1900 AD. Secrets of national health lies in the homes of people. Statement by Florence Nightingale. Missing cases are detected by sentinel surveillance. Which of the following is not a primary prevention strategy? Breast self-examination. Screening of the diseases is which type of prevention? Secondary. Smallpox vaccine was invented by Edward Jenner. Physical quality of life index includes infant mortality rate, literacy, and life expectancy at 1 year. 1 DALY signifies 1 lost year of healthy life. Desks provided with tabletop to prevent neck problems is an example of specific protection. James Lind is related to the discovery of prevention of scurvy. Theory of web of causation was given by McMahon and Pugh. All of the following are eradicable diseases except tuberculosis. Eradicable diseases are guinea worm, polio, and measles. DALY is disability adjusted life year. Demarcation line in iceberg disease is between apparent and inapparent cases. Maximum damage to Napoleon's army during the march to Moscow was done by typhus. ICD-10 has how many chapters? 22. Actually 21. Sullivan Index measures life expectancy adjusted without disability or free of disability. Missing cases are detected by sentinel surveillance. Purpose of sentinel surveillance is to know the total number of cases. Sullivan Index measures disability. PQLI is infant mortality rate, life expectancy at 1 year of age, and socioeconomic status. Primordial prevention is the prevention of diseases through modification of their risk factors. Emporiatrics deals with the health of travelers.